All right, welcome everyone. We just got another one of our guests in here, perfect timing. I'm Susanna Ledesma Woody. I am here with the Del Valley Community Coalition and some special guests. Um, the reason why we're here is because the latest data from the COVID mass distribution site came out last night during Judge Brown's town hall. And let me tell you, when I listened to that town hall, I was livid. And I was livid for several reasons. But before I go into my reasons and tell you guys, why I was upset, I want to go ahead and introduce our prompt to discussion panel. And let me go ahead and start off with Mr. Saldana.
Hey everybody, I'm Paul Saldana with the Austin Latino Coalition. Thanks for having me.
All right, Matt.
Hey everyone, I'm Matt Worthington with the Del Valley Community Coalition. Excited to be here.
Hi everyone, Claudia Zapata with the Del Valley Community Coalition. Excited to be here too.
Jill?
Jill.
Oh, hi, I'm Jill Ramirez. I'm with Latino Healthcare Forum. Thank you for inviting me.
Yeah, no, absolutely. And the reason why, I invited you guys and I wanted a couple of more people, but because you guys have been instrumental in bringing awareness and attention to the disparities regarding COVID vaccine and the COVID high positive cases within within the Eastern Crescent and our Latino and Black communities. And so I wanted to sit down and just have like a real talk. Let's talk about what's going on without having a script, without having somebody monitor us and check us and say, oh, don't say that, that's not nice, right? Let's be real. Let's talk about what's going on. Let's talk about why we're upset and what needs to happen in order to change the break the cycle of this historic neglect and disparities within our community. So before I begin, let's go ahead and start with, Paul, you have been a wonderful partner with the Awesome Latino Coalition in helping DVCC get off the ground and get PPE to our communities and try to stop and slow down the spread of COVID. Let's talk about what your thoughts are and the work that you've been doing in trying to get vaccination distribution sites open in the Eastern Crescent.
Yeah, thank you, Susanna. It's been an honor to work in partnership with the Del Valley Community Coalition. I think we have two great coalitions. Like you guys, we've been on the ground for over a year now at this point. And so, a lot of the inequities and things that we're talking about now were things that our community was talking about a year ago. We knew that Black and Brown communities would be disproportionately impacted by COVID because we're overrepresented in those with chronic diseases. We are overrepresented and those in low-income communities. We're overrepresented in the fact that we live in areas with non-existent healthcare facilities, hospitals, pharmacies, groceries, all those types of things. And we're also overrepresented in those who work as essential workers, frontline workers. And so, a year ago, you may recall that it was very difficult for our people to get access to COVID testing. We were subjected to a process that is still going on now. We would have to go into a portal system. Didn't take into consideration the technology issues, the fact that many folks in our communities don't have Wi-Fi, all those things. It was very difficult for our community to get COVID testing. And then of course, it was very difficult for our community to get access to PPE. You all may remember a couple years ago when the city was under a water boil notice, they set up water distribution sites all over the city. But when we were under a pandemic, the city failed to set up PPE distributions, the basic mask, hand sanitizer, those types of things. And so that started basically we were thrown into being forced to fill the gaps and voids that were being left by Austin Travis County, which meant we had to go and learn firsthand how to organize, how to do turnkey operations, how to get access to PPE, and then put it in the hands of our community. And then we haven't even talked about the fact that there was a lack of culturally relevant bilingual information available to our communities that talked about the risk of COVID, how do you protect yourself, those types of things. It was pretty much all the information was done in English. And so over the course of from April to the end of year, we end up serving over 18,000 families. I should also say that despite the fact that both the city and the county received federal funds, and this was under the Trump administration, our coalition received no support from the city or the county. We had to learn how to raise money. We had to write grant proposals. Thank goodness we had the expertise of Jill Ramirez and her staff, who were really instrumental in helping us put together those grant proposals. And so we were able to do that. At the end of last year also, probably September, October, we had already started talking about that when we get to the point that we will have vaccines available for our community, we have to start the public education, public information process in doing vaccine confidence within our Black and Brown communities. And so we were assured by the folks at Austin Public Health that that was going to happen. Here we are in April, going into the spring of 2021. There are still many people in our communities that don't have vaccine confidence. They're concerned about the side effects. They're concerned about the long-term effects. And because we're overrepresented, as I mentioned earlier, with chronic diseases, they're concerned about how the vaccine might affect the fact that they're diabetic, they have our heart medication, all these other things. And then because our communities historically have been subjected to unethical historic medical treatments, they're concerned about that. They're also concerned about what vaccine they're going to receive. Is it going to be the Moderna? Is it going to be the Pfizer? Is it going to be the Johnson & Johnson? There was speculation for a while that AstraZeneca might be available. So there's concern about all of those things, right? And so that has created some hesitancy. And then of course, when the state finally started making the vaccine available to folks, all of us remember, and Matt, I remember the map that you put together that basically showed that all of the providers for the vaccine, the majority of them were located west of I-35. Again, because historically the inequities on the Eastern Crescent, no medical facilities, no hospitals, none of those things. And so here we are, months into the vaccination process, and we still continue to see inequities. As of the end of last week, the Austin Public Health has distributed more than 163,000 vaccines. 60% of those vaccines have gone to white folks, the folks in the white community. And I was looking at the latest data. We're in week 64 of the COVID pandemic. Latinos still represent 45% of all the COVID cases. We still represent 45% of the hospitalizations. We have now lost 818 people in Austin, Travis County to the COVID pandemic. 50% of those who have died in Austin, Travis County are Latino. That's more than 400 people from our community have died. And if you start looking at the vaccinations that have been available to zip code 78744, where I live, happens to be also the zip code with the largest Latino population. Out of the 163,000 vaccines, our zip code has only received 634 vaccines. Del Valle, 78617, 30,000 people have received 137 vaccines from Austin Public Health. I failed to mention 78744, there's 50,000 people. Montopolis, where Jill has her office, Latino Healthcare Forum, more than 53,000 people, they have received 515 vaccines. I didn't catch Judge Brown's town hall meeting, but I pretty much already knew what the data was going to tell us. I did see a couple of the charts, and what I noticed that over the course of the last 3 weeks, 3 weeks ago on a weekend, it was 48% non-Latino. And the most recent weekend, it was over 71% of non-Latinos receiving the vaccines at CODA. So, I mean, like you, I am at my wit's end. I don't know what else we need to do or say that for us to get vaccines to our Black and Browns communities on the Eastern Crescent. We talk about the fact that distributive justice should be imperative. We issued a public statement in January and February reiterating how important it was for us to abide by the moral principle of distributive justice, which basically says that the distribution of vaccines should go to the communities who have been overburdened or disproportionately affected by COVID. That is basically something that medical physicians and ethicists practice and preach. Unfortunately, Austin being a very progressive liberal city, we're not abiding by that. So I'll stop there. I've said more than enough.
Yeah, no, you said a lot of really great things, and all those zip codes that you actually mentioned, and what I don't think a lot of people realize is all of those encompass the Del Valley ISD. And so when I talk about Del Valley, I talk about all the way going up to Maynard, going all the way down south to Creedmoor, east to the Travis County line, and then west to the Montopolis cutoff, where we're at. So all of those are key zip codes that are within the Del Valley ISD boundaries, which is what the coalition's primary focus is. And I'm going to go ahead and try to share that file that you were talking about so people can kind of
Yeah.
see how that went. Let me get that popping. And while I do, Claudia, Matt, Jill, do you want to add anything while I get this shared?
At this point, I think we have gone over this many times in terms of why are we here at this point in terms of lack of the infrastructure really reflects a lack of investment from a lot of people who have had the power of the purse for many things in the community, whether it's the county, whether it's the city, a lot of entities, all the people who receive our tax dollars as to how they use that funding. And so I think we've gone over that many times. I think we need to figure out how do we get the vaccines to the people in the community.
I guess the thing that, listening to Paul talk about this, that just kind of came to my mind is like, this isn't news. Like you said that. And this also is not new information to the entire country. The National Academy of Medicine had recommended states adopt throughout their rollout phases using geography, specifically the CDC Social Vulnerability Index, as a tool to ensure equitable distribution throughout rollout phases. I mean, like people did the homework. And so I think that there's not only that, but, you can go back to the Texas Tribune in January, and I'm sure even before then, where Black and brown communities in Texas were expressing concerns about, hey, what is the plan for ensuring this? And immediately after that, the Texas Department of State Health Services sent a very clear message to communities across Texas when they banned the city of Dallas from using their vaccine hub site, which was literally established in response to a lack of providers in South Dallas.
Mm-hmm.
They banned them from using that site to prioritize specific zip codes that had been hardest hit. And they said, we do want people to get the vaccine in hardest hit communities. But it's very clear that the methods and strategies that we've adopted at the statewide level, that's not working. And I think it's very clear data from the local level, like you can't keep doing the same thing and expect different results.
No, that's a great point. So pulling this chart up, the reason why, I said I was livid, one of the reasons why was because this is basically saying, like, as the weeks progressed, the amount of Latino and Hispanic people that were getting shots actually decreased dramatically, which was the complete opposite in the intent of having that mass distribution site at CODA where, our community is held. And so what we've been saying was that you're using a technology to register folks, knowing that there's inequities in technology within the community that you're at itself, and yet you're relying on that same technology to register and get folks in this community vaccinated. That doesn't make sense. It doesn't work. It hasn't worked from the beginning, and it's not working now. And clearly it's showing that younger white community members are getting these links, and they're more proficient in technology, and so they're able to register themselves, their friends, their neighbors, and so it's counterproductive to what we are trying to achieve.
Mhm. And then
I think we have to distinguish between the portal that we were using at CODA is extremely simple compared to the one at Austin Public Health. I can tell you that we could sign up people using the portal at CODA in 3 to 5 minutes, one person. And it would take us days to do Austin Public Health. And so I think at CODA, a lot of the people that we know they got vaccinated were because they were part of community care, which is great. You know, we want to give them credit because they take care of their clients. They know what their clients need and they work well with them. Is the other people who don't belong to community care and outside the system of that system. And those were the people we were trying to help. And I can tell you that we got really good at that. And we could sign people up really fast. But what happened, CODA now is doing second vaccines. And so we have a list of people that wanted the first vaccine, which was working okay. But what happened too was that the code got out into social media. And so people that can do social media could get in because it was so simple. It takes 2 minutes. So by the time we were signing up somebody that would take 8 minutes, other people that could access that code in 2 minutes were signing in. So the slots left really quickly. Like you could log in at 6 and in a few minutes they were all gone. So I think it was it's not, if that technology has to be there for whatever reason, it needs to be extremely simple to use. Or no technology at all, better.
Yeah, and I mean, going back to reiterating, like, this is not new. I mean, I pulled up a document that was provided to the city of Austin and Travis County last year. The document date is July 1st, 2020, which means that all of the information gathering had to have taken place before then. And it's the Latinx COVID-19 Health Equity Action Recommendations. And I mean, in here, it clearly states we need alternative messaging methods because there's low technology literacy, low technology access, limited availability due to work. We recommend providing a hotline in Spanish. We recommend mobile clinics in order to target specific zip codes and prioritize specific zip codes. And it's not, I mean, and this was back in July of last year. So I'm just wondering why, I mean, one thing that really upsets me is that we have our elected officials and community leaders talking about like, oh, well, we need to explore we're going to explore other options. We're taking a look at mobile vaccine clinics. And I'm just like, you're exploring other options? Like, we can't be exploring other options like when we've known about this for almost a year now. Like, it's been right in front of you this whole time. And, Austin and Travis County like to tout themselves as very like progressive, data driven, like, oh my God, look at us, using all of this data to help us coordinate and focus our goals. But they're just completely neglecting to accept the fact that they have completely failed Black and brown communities on the Eastern Crescent, but that's okay. But I think my thing is acknowledge it. Like, don't try sweeping it under the rug and then go around and do like this showboat parade of like, oh guys, look, we have like 160,000 people vaccinated. Amazing. And it's like, just accept some of the fact that you were just ill-prepared, ill-equipped, and be able to work with the community leaders who have been providing actionable responses for over a year now.
And Claudia, I want to mention, can I throw in, pardon the interruption, there was actually a prelude to that July document that you're talking about. And that happens to be a set of recommendations that all of our coalitions developed in partnership that we actually presented to the city back in April and May. We actually ended up prioritizing and made it simple. We gave them 10 recommendations that we actually grouped into 4 major themes, and that included a lot of that. And so some of those recommendations that you were reading were actually taken out of the proposals that we had developed back in April and May of last year.
Wow.
And then they presented it in that, which, by the way, they ended up putting, Susanna, you remember this, and Jill, I know you were on the call. We did that meeting with the mayor, and remember, we asked him for 2 things. We asked him create a Latino task force, number 1. Number 2, so that we can work in partnership with you to implement a mitigation plan to address all the things that we're talking about now. And the response from the mayor was no, he did not want to do that. And so that very next day, that's sort of when we went into action. But a lot of these, and the same holds true with the technology issues that you were referencing as it relates to the portal system and getting the COVID testing. When we were assured that though our communities would not experience those things when it came time to getting the vaccine. And here we are regurgitating, belaboring these points that should have been addressed and weren't.
Yeah, Matt, let's talk about the resolution that Councilwoman Fuentes had to go out of her way to propose and it did get passed. But how ridiculous is it that we had to get a council member put a resolution in there to help fight the inequities that everyone knows is going on and that we face every day? Let's talk about that for a minute.
I think what was astonishing to me, even before I learned about the councilwoman's resolution, was, knowing some of the data that we had seen, that the state literally had published zip code level administration data. So even at a high level, you could see who is most represented in local communities across the state. And it was very clear that in Austin, if you were west of 35, that you were getting access to it more often than residents east of 35. Okay, no surprise there. It's like the same map, like of Austin. But shortly after that, the city had announced, I think it was through APH, they announced that they were going to pilot a drive-through site in West Austin to make it easier for folks. Now, listen, I'm all about getting as many people vaccinated as possible. So don't get me wrong. I'm not going to say don't have a site in West Austin, but when you cite that the reason is that you're trying to make it easier for folks that appear to be doing a good job of getting their shots already, easier access, that's very confusing. And I think especially when there's information coming from communities highlighting the ways in which we can make this easier to access, to say, look, there has to be opportunities to kind of protect space for these communities. And there also needs to be, as Jill said, easier methods for people to sign up. Like vaccine drops that also is not news that is incredibly complicated. I mean, Lena Hidalgo out in Harris County was saying they explicitly decided not to adopt that method because they knew it was going to be complicated, too complicated for folks in their communities. And so I it's like then finding out that the councilwoman, which I'm all in favor of Councilwoman Fuentes going to the lengths that she did to get that resolution passed. But to me, it was, I don't know, it was just kind of like a little, like, I don't understand why a resolution had to be put together to get mobile clinics in these communities when the data is crystal clear that there needs to be, like, I don't know what other flags need to be flown to say something's not working over here.
Yeah. Speaking of
I want to add to that because, I think that I'm glad that she got the resolution passed, but we went, as Paul mentioned earlier on, with another resolution.
Mm-hmm.
And that not even got anything. Paul, you want to talk about that? Because really we have to applaud that she got the resolution through because the other one didn't even get on.
Yeah.
And we had to deal with people dying from COVID.
Yeah. Yeah, we didn't even make it through the Latino Quality of Life Commission. It didn't even get past that. There were conflicts of interest coming in from city staff who blocked that resolution from even getting to the city council. Some of the council members didn't even know we had made an effort to do that. One of our coalition members two of our coalition members were on that Quality of Life Commission, and they got basically, our resolution that we had drafted and worked on didn't even make it past our own Latino Quality of Life issue, which is another conversation we'll need to have down the road at some point.
But I think the key is that we're not at the table when they're planning. I would have never agreed to go to a technology system knowing that the first people that were going to be vaccinated were older adults. We do Medicare in our office and we do everything by phone or we go make home visits. They don't have the technology. And you know, that's the first group that you're going to do the vaccines and you choose that method. To me, that was like, people, we were not at the table to express all what we are expressing tonight. So I think part of it is that we are not at the table when all these other plans are being made, and they should include us because I think we have the experience to guide them a little bit better.
I think it's very clear that they don't want us at the table. I mean, I think they've made that exponentially clear in their actions. And they love to show up at our sites for improv, like photo ops and news coverage and media. And they love saying that they work hand in hand with us. But when it comes to, I mean, I don't know if it's just that they think we're incompetent and don't know what it is that we're talking about. But when you discredit strong community leaders such as yourselves, it's incredibly angering, because how are you going to discredit someone who actually lives it and who experiences it on a weekly basis?
Yeah.
It's so angering. And so, I mean, at this point, I'm like, do I even want a seat at their table? Like, I don't even think I want a seat at their table, because I mean, why am I going to sit side by side with someone who isn't going to take what I, who's going to take what I say with a grain of salt,
Well,
even though that you have data
yes.
backed up.
Having a seat at
You're
the
right.
table gives you easier access to throw your drink in their face.
That's true.
Look at it that way.
But that did happen because we were part of that coalition, right, Paul?
Yep. Mhm.
And we did have ideas, and they were like, okay, you're right, Claudia. We were just invited para que no dijéranos, like,
Mhm.
yeah.
Exactly. It's just
Well-
like to show that, but you can go ahead and jump in, Paul.
I was going to say, to your point, I actually learned a new term today, and I shared it with Jill and another friend of ours this morning. I learned there's actually a term for that, what you mentioned. It's called performative allyship. And that's basically when people show up just for the photo ops and that's it, kind of thing, right? And so don't say you're an ally when you're just there for the photo ops, kind of thing. That's performative allyship. That's a new term that I learned today.
Yeah. Wow. I agree with all of that.
Well, the other thing I want to mention real quick is that there's an article that came out tonight from the Statesman that talks about our latest event, and even in that article, it talks about how the Statesman has reported in the past, and they reported again today, that 20% of Latino households don't have internet or Wi-Fi, and so it should not be. If you have a portal system, or if you have a process that requires basic fundamental Wi-Fi internet, and we already know that 20% of Latino households in Austin, Travis County don't have it, it's not going to work. It is absolutely not going to work.
Yeah, I want to jump back into like the mobile clinics that they're proposing with Austin Public Health, and I don't even know if the county is doing it, but one of them was Meals on Wheels. And while I think that's a really great program, if you're not part of that program, and they do the churches too, and if you're not part of that person, how are you supposed to get notified? How are you supposed to get signed up? So again, you're still limiting the amount of people, or the people that can register and or get these vaccinations. And I was just like, that type of mobile clinic doesn't work, and it hasn't worked in the past.
And I think also
Okay,
having
I'm sorry.
people.
Before we leave the mobile clinics, before I forget, because I'm older and if I think of something, I have to say it. Otherwise, it goes away. But a while back, Paul and I were talking about ice cream trucks taking something similar to that, because they do have the ice, whatever you need. And it's a family thing where kids get ice cream. I mean, we were thinking outside the box because nobody else was thinking about it. Of course, people thought we were crazy, and I'm sure you are going, what, ice cream trucks for a vaccine? But it's similar to something where you go into the community has an idea what you do, and then you pair that up with a new activity so that it's not something totally new. And
Mhm.
so I think we need to be thinking of lots of other ways that are not traditional, like medical stuff, which is a mobile clinic, is a traditional way of getting some, like the Skippy bus that would go to the school and do dental from St. Davis, stuff like that. But I think we need to look beyond the regular stuff, because we got to get those shots quickly into people.
I
Sorry.
think
Yeah, no,
no.
I mean, Jill, like one of the things that I thought of when you were talking earlier was the fact that Saturday Night Live made a skit that explicitly made fun of sign-up methods and the ways that they were excluding older adults. And it's just like, it's insane to me that we could all watch that and laugh and think that's funny. I mean, Saturday Night Live is always funny, but that it's so bad that it's a Saturday Night Live skit. Do you know what I mean? And then continue doing the same thing that like was made fun of on Saturday Night Live.
Mhm.
Go
Yep.
ahead, Claudia. You had something to say?
Oh, no, I was just going to say that, when it comes to also us thinking outside of the box, it's been the city and the county who have kept these ideas from being able to like actually be action, and like taken action upon. I think that I mean, and I only have one example of someone trying to, and I'm not going to name names or provide any specifics, but I know that there was someone who was talking a group out of becoming a provider, and working directly with folks in order to get the vaccines, and instead was like, oh no, we're with the city or we're with the county, and we'll just give you the vaccines. And it's like, why? Like that's kind of shady, because you're not, like, you haven't been helping us this whole time, but at the same time you're telling us not to become providers so that way we can start managing it ourselves. And so I think that there probably have been like other instances of this happening, and this is just the only instance that I know about. And it's frankly like it's disgusting.
Oh yeah, Jill and I can point to numerous examples of how that has happened over the last year, where we would come up examples and they would be frowned upon or initiatives. And then the next thing we would hear is that they were replicating exactly what we had recommended. And then in many instances, when they wanted us to be part of the city's task force, they wanted us to sign confidentiality statements to the very recommendations and ideas that we had already implemented and were speaking about, to show them or demonstrate to them what we were doing. Maybe I can change the subject real quick on something, and that is the fact that, as we know, some of us are getting the next round of stimulus checks. And so with the recent act from Congress, remember that both the city and the county are going to be recipients. Actually, Central Texas is actually scheduled to receive more than $500 million of relief funds from the American Rescue Plans. And so Austin is getting about $200 million. Travis County is getting another $250 million. And the reason I bring that up is because one of the things that I'm hearing that's going on is that there's not enough bandwidth. There's not enough bandwidth at Austin Public Health. There's not enough bandwidth at CODA. There's not enough bandwidth through Seton Ascension. There's not enough bandwidth community care and everybody else. And so these inequities that we're, again, belaboring tonight, one thought could be, well, why can't we bring in contractors or providers who can set up pop-up clinics, or who can set up temporary clinics at the high schools, at Del Valle, places in the Eastern Crescent, at the churches, those types of things. And what I keep hearing from folks is they don't want to do that because it'll cost money, and they're concerned about how long it may take for them to get reimbursed, or whether or not the city or their county is actually eligible to that. So we're putting money ahead of saving lives. And I think that's also an inequity, and something that really frustrates me and angers me, that until we know if this type of pop-up vaccine event will qualify for reimbursements, then the city and county are not interested in bringing in contractors or providers to work with our communities. We know our community best. That's why we have been fending for ourselves, filling in the gaps and voids. That's why we have, lines of people in cars are lined up for hours and hours for the events that we're doing. We know our community. We've been doing this for over a year, and they just won't take advice. So it's like we come up with viable solutions, we come up with ideas, but they're shot down every time.
Yeah, I literally wrote a a play-by-play on what needs to happen, shared it, and now all of a sudden it's like, oh, we're gonna try some of those methods. Yeah, you should have tried them a year ago when they were given out to you. Um, One of the things that I'm concerned about with the Del Valley part of it was Paul and I have been working in the background trying to get a provider out to the Del Valley area so that we could focus and, honestly discriminate and only get people in the community vaccinated.
Right. And those are-
Um, so that has been ongoing. We were actually told today that we were going to be denied the vaccines. We spent weeks of trying to get this set up, booking the venue, getting volunteers, getting a provider to administer it, and then just to be told like, oh no, it's coming down to funding. Why is it always when it comes down to my community or our community that funding is not available or funding is an issue? That kind of stuff is like old already, and we are so tired of hearing that. Anyone else want to comment on that?
I want to say that I saw some money being given to some people last week who don't have a lot of experience managing a food bus. They were given over $500,000.
And they had the audacity to call themselves Equidad, which in my opinion is not only cultural appropriation, but it's the direct opposite of what it's intended to be. To have no experience, no performance measures, sole source contract. It was actually more than $500,000.
Yeah.
And that's just crazy. It's just,
So that is what we see. We see that people who know people and they put themselves ahead of community, but yet they're there and they know what's happening and they're able to finagle that money for themselves and not going to community. Because imagine how many providers for vaccines could we have in Del Valley, around Hornsby Bend, if we had that kind of money given to spend that way.
Mhm.
Let me tell you about the position they've put us in Del Valley. They put us in a position that we have to go to the state and to get our approval for our student to dilute the vaccine in order for us to distribute in Del Valley. That's the kind of position that they've put us in, to where we have to use our students. And I'm very confident that our students could do it. It's just that that position that they've had put us in, having to go outside the normal realms of, having, we have a healthcare district in our, we pay taxes to this place. We have Austin Public Health. We have all these people and these things around, and yet Del Valley has to go and get special, like have to jump through hoops of fire to get vaccines. How ridiculous is that? That's unacceptable. And I mean, I'm proud that our kids are saying, yes, I'm going to step up because I know my community needs it and we need to do what we need to do. And I'm proud of our kids, but that's unacceptable.
I mean, it shouldn't come down to that. I mean, it's hard because it's like I feel sad that I cannot get excited when, for example, when the information came out that Central Texas was going to be getting like over 500, what was it, over $500 million in aid. And I could not feel happy, unlike some of my counterparts and some of my colleagues, because I was like, oh, great, that's just more money that we're not getting. Like, I mean, that was the first thing that came to my mind. And I mean, it's sad that, as a person of color, and, and like, I'm I'm like active within our community, and like people still don't care what it is that I have to say. So I can just imagine how helpless some of our community members feel, and how betrayed they feel by the city and the county, and the state especially. So it's very disappointing that we're not able to partake in those like joyous, quote unquote wins, along with other folks.
Yep, yep, yep. So maybe that's our call to action, because I think people are tired of hearing us and seeing our faces and names. And I'll take it a step further, and I think y'all would agree. In many instances, we have been blackballed by folks. Our opinions have been, and data. We use data. We use their own data, but even that, in many instances, our perspectives and opinions and our voices are minimized. So, my challenge to folks who are out there listening to our conversation is they have to get comfortable with being uncomfortable. We talked about being allies and everything that's been happening over the course of the last year, unmasking the historic inequities of what the Black and Browns communities have been experiencing for decades and decades. The fact that we continue to be marginalized in the middle of a pandemic, and we need new allies, we need new voices. We need new people to get uncomfortable with being uncomfortable and step up and join our cause, join our voices to make sure that we're getting vaccines for our Black and Brown poor communities on the Eastern Crescent.
And I think the challenge too for our elected officials is, we're in a public health crisis, and to get out of this, you have to get your community to a sufficient level of herd immunity. There's going to be a point at which you vaccinate all the people who have a pretty easy time getting a vaccine. And at some point, you're going to have to figure out, how do you get these communities in the Eastern Crescent that have had a very difficult time in the door to get a vaccine? And if you don't have a plan for that, I'm very confused how we actually get out of where we're at right now with the pandemic.
Absolutely.
Yeah, no, that's a great point. Hopefully they listen to us and they go back to our Facebook pages, because I'm sure we outlined what they can do to get there. I know as a coalition, we plan on getting tablets so we can go door to door and register people. That's how dedicated we are to our community. We are volunteers, folks. We don't get paid for this. We have full-time jobs. We have children. When we're not volunteering, we're with our families. But we understand that if we don't do it, we know that our government is not going to do it. And so it's not going to get done. And we don't want our community to continue to suffer because of the lack of empathy and, the lack of attention that anyone is giving us. Anyone else want to put some final comments on there?
No, I'll jump in. I think you're correct. I think by default, because we stepped up to volunteer, we ourselves became essential frontline workers on the ground. And I remember early on, when the pandemic hit, not really fully knowing the potential consequences or risk associated with what we were doing early on. The health effects. We haven't even talked about the mental health effects of what we've been subjected to, the mental anguish that we've been subjected to over the course of the last year. And so, we definitely have to take that into consideration. And you said it best, Susanna. In a city that is supposed to be as progressive, and we have all these rich folks, and, you have the multi-billion-dollar budgets at the city and the county, the school district, AISD. And the fact that volunteers are having to step up and do this work is just unfathomable, and it's unacceptable. And so that's all I have to say tonight.
Matt, you want to put some last minute words?
I think that in a year filled with so much grief and so little time to process that grief, because people have been in a constant state of responding, it is so essential and necessary that relief is brought to our communities. And I think that I don't really know like what else needs to happen. Everything I've heard from everybody on this call, I think some people might listen to this and some people might say, oh, they're just complaining.
Mhm.
But solutions have been identified, not just by us. And oftentimes it's going to research
Mhm.
and pulling from research-based method. I mean, like, so to me, it's not like there isn't a plan in place. There's not a lack of a playbook to bring this kind of relief to communities. I think the question is just like, what else needs to happen? I mean, we've been in the vaccine rollout for almost 4 months now. That's a
Mhm.
third of a year. I don't know.
I would like to say that as much as people say they want to do different things, their actions are very different than their words. And so I may hear a lot of people say, no, we care about what happens. But when you don't put the money where it's supposed to go to help our people, then, you know, you're just talking. It's like, but we have had that all along for many years. And so they just continue doing the same thing. So we're just going to have to figure out ourselves how to manage this, like you said, Susan, ourselves, like get what we can, try to get here from there, work together. And there are some people in the system that want to help us. And so let's work together with them.
Yeah, I will say that for those naysayers that say that we're complaining, the solutions that we've provided, we done everything that we can do up until actually having the vaccine in our hand. Like, I mean, we're not just sitting around here complaining. We literally did everything and all the logistics that come with getting a mass distribution site up and running. So please don't start at me because I will not be happy. But we, not only did we do our own logistical analysis and getting everything ready, we provided those same processes to people so that they could use to get more sites out in the Eastern Crescent. It's just not, they don't want to. Basically, that's the bottom line. They don't want to do it. And so I don't know what else to do besides calling them out, and I will call them out in just a minute.
No, I
Let
was
me go
gonna
ahead and go,
say
Claudia.
that's-
Let's go ahead and get your last minute closing remarks.
I mean, you were gonna say exactly what I was gonna say. I mean, you don't want to listen to us? Okay, we're gonna make sure people know who you are. I mean, sorry, like that's the name of the game. You don't want to listen to minorities, community leaders, community organizers, the very people who help amplify and empower you, and get you votes. Okay, all right then, all's fair then. I think that we are taking note. And I mean, if anything, like, if you're worried about money, chances are that you're likely going to be worried about your job and re-election security. So just know that we see you, we know who you are. We're taking notes. And additionally, just a little, because I'm treasurer, I just have to mention, because we are going to buy our handheld tablets and devices to equip our volunteers to be able to go door to door in the Eastern Crescent, please make sure to donate to the Del Valley Community Coalition. I will post that our information on our site once again and in the comments in the FB Live, because that all of your funds go directly back to the community. So we need it. Help empower us so that way we can save our community, y'all.
All right, great. So I'm gonna start with the city. Mr. Mayor Adler, you have failed the city. I feel like I'm Green Arrow right about now. I don't know if y'all watch the Green Arrow, but honestly, you failed. You failed to implement a process to provide half of your city with vaccinations, and then before that, testing kits. And I know that I've seen you around at some of our events, and you just stand there and not actually do anything. So please, if you come out again, pick up a box, that would be great. Also in public health, you have failed this city. You have failed to distribute in the Eastern Crescent. You have failed to provide mass vaccination sites in the Eastern Crescent, knowing that you have an entire population that is not being seen or heard. Austin City Council members, with the exclusion of Fuentes, because she is gone and she has rolled up her sleeves and she's done what she can do, you have failed the city. All of our allies, our brown and black allies, where are you at? I've seen your signatures on your memos. Great. What is that going to do? What is a piece of paper going to do if you don't put any action into your words? Nothing, not a damn thing. So until you start actually doing something and holding the manager accountable, don't talk to me. Don't come ask me for help. Don't ask me to push your crap around. I'm not for it anymore. Don't sign any more stuff. Don't do public news releases. Don't do any of that shit if you're not going to put any backbone into your words. It's unacceptable. You're just placating us and you're really just pissing people off. All right, I think I got the city. Let's jump over to the county.
City manager.
Oh, yeah. Well, the city manager is not an elected official. The people that need to hold him accountable are the city council. If you don't have the backbone to fire that guy by now, don't look for my support. He needs to go. He needs to go last year. Hold him accountable for his actions and his lack of action.
Yep, it's time for him to go.
That's your job, is to hold him accountable. Don't let him placate all this BS that, oh, I'm waiting for the city manager. You're his boss. The 9-10 of you are his boss. We can't tell him what to do. You can. Hold him accountable. Who else do we got in the city? That's it. Okay, county part. Mr. Judge Brown. While I appreciate your enthusiasm to try to help our community, the actual lack of progress and the words and the placating that you have given us is not okay anymore. Like I tried. I try to be open-minded and give people a chance and understand like there are things going behind it. But I talked to Paul and I talked to the school, and we actually talk and communicate to each other. So we know what's being said to each other. And what's being said to me is not the same thing that's being said to other people. That's not okay. We're in this together, and we would appreciate it if you would be in it with us. The other commissioners, where the hell are you? Where are you at? I haven't seen you. Where's our county commissioner at? What part has she put into this? Our other commissioners, where y'all at? I heard y'all asking for data, asking for results. But what are you doing to close that disparity gap in the Eastern Crescent that you know has been neglected historically? Where y'all at? Okay, that's them. Central Health, community care. I don't even know what to say. Like, you are supposed to be helping low income, uninsured people. That is our community. That is the majority of our community. Why have you not mobilized in there? You have no excuse, none. Let's see. Board of Central Health, where's the pressure at? Are you not paying attention? I'm not gonna sit at your board meetings and tell you what you already know. You know this area. You know what needs to happen. Where are you at? Don't look for me to tell your board what to do. You tell them what to do. You know what needs to happen. What else am I missing? State reps. I don't even know where to start with y'all. Y'all the ones that's supposed to help get us our vaccinations. Putting pressure on the federal government to get us more vaccines. Where y'all at? This is unacceptable from all levels of government. All of y'all. All right. Let's see. School board, Del Valley, you guys are amazing. I don't know what else to say. We go above and beyond. We go outside of our educational realm to get help for our community. I wish other people would do the same. You know, you think outside the box. Just because you're in a particular role doesn't mean that that's all you have to do. Sometimes all it takes is picking up a phone and using your influence and your position to get somebody else moving. Let's see. I think I got everybody. Anybody else want to throw in something?
I do, since you're on a roll. There were two other things that I wanted to mention that speak to the historic inequities, and we actually said it in our statement back in February, but I think it also further sheds a light on the historic inequities, and it calls into question why we're in the situation that we're in. The first one is, remember, back in 1995, the city of Austin made a decision to turn over the City County Brackenridge Hospital over to Seton Ascension. And that was the oldest public hospital in the state of Texas that actually opened back in 1884 that served primarily Black and brown poor people in Austin, Travis County. So my point or question that we've been raising, or that I've been raising since February, is did our city, did our county miss out directly on opportunities to receive COVID relief, to receive vaccines, since we no longer own and operate Brackenridge? Where did those vaccines go, and who actually directly benefited from those? You can look at who's doing the vaccines at CODA, and I don't have to mention any names. Then in 2014, when Travis County voters created the healthcare district,
I mentioned names. Come on.
Seton Ascension is running the show over there, and I heard a rumor they're going to get a contract to continue running it moving forward. So then in 2014,
wait. So are you saying they're basically going to have a monopoly on our vaccines?
Yeah, I think that's already started. I think that already happened a long time ago. That's my reference to this. Then in 2014, when we created the healthcare district, remember, Central Health approved an annual transfer of $35 million in perpetuity, unless something changes, to the Dell Medical School. And that was supposed to be to support safety net healthcare delivery, and was supposed to be a transformation of healthcare delivery in Austin, Travis County. So to date, Dell Medical School has received $245 million. So once again, we got to ask ourselves, who directly benefited? And why are minority low-income communities still not getting still disproportionately impacted by COVID, and we're still not getting the vaccines? And so I think that requires further investigation, and something that we need to look at, because that has also hindered and helped to create the predicament that we find ourselves in now.
Yeah, Claudia, I sent you a chat. I don't know if you want to take it or you want me to take it.
I would like to. Okay, Claudia, I'm sorry.
No, it's okay.
didn't
Jump
hear
in,
everything
jump
because
in.
the dogs were, like over there fighting. But I want to say that Central Health and Community Care, I know, Susana, that you mentioned that they still need to step up. But I think right now, I have been doing this a lot longer, and I have seen Central Health come a long ways from where we were before the medical school, right before the medical school got here. And so I have seen them, the shift of how they do want to do things in Del Valle. And when you look at Del Valle, I tell people it's like 100 miles, right? The area, it's a huge area. And so they are constructing some clinics. I think right now that's for later. And so I can see, for us, do we want the vaccine now? We want to do things that we have in our community. So we have to look beyond that. We have to see if we can get schools be part of the, where we give out the vaccine. We have to look at churches. We have to look at restaurants. I don't care, wherever there people meet normally, that we could probably get some people to go there and get the vaccine. But I think that I really feel that Central Health has stepped up, and Community Care has also stepped up, because I knew them from 20 years ago. Okay, so back then compared to now, they have. And so I understand you're looking at it from now, but if you look at historically too, they have come a long ways, and they're doing a lot better now. We can all improve. I can improve. But I think, to just paint them all the same, you cannot say Central Health is the same thing as Austin Public Health, because that's not the same.
Okay.
Okay. So we have to
disagree.
I don't believe that.
Yeah, I will respectfully disagree with you, Jill. I've been doing this for 20 years with you. I started really young.
I remember when I met you, you
Yeah.
came to our office,
Yeah.
remember?
So,
Yes.
Mhm.
while I do say they have made strides in the last few years, and I will give them props for that, their mission, and it's not because they wanted to. Let's be real, guys. We've had to like push them along the way as well, right? We had to go down and talk, and it's not like they did it out of the kindness of their hearts.
No, I agree with you because we used to go to communities court
Yeah.
about the medical school, right?
Yeah, and so and while I will give them credit for making strides, I do not, just like with everyone else that has done something, I would say hashtag do better, right? Do better, because we deserve better. We pay taxes just like everybody else, but yet, once again, we're neglected in all forms and all realms of our community, and including the community care. The community care is the device that's being used to get people registered at CODA. That's what they're using. They're using community care. And yet that data is still saying we are not getting vaccinated. So that's what I mean when I say community care, central health, do better.
You
can
know,
do better.
well, the way I look at it, Jason is taking care of his people. He has all those clinics and he's taking care of his clients, but he's not responsible for the rest of the people who are not part of community care. That's the other people, right? Other people involved. So for me, it's like, I really want to look at this where we know what works. I want to have a lot of Jasons around, okay? Because I know he works well. And so for me, if we can get lots of Jasons, I will be happy because he has made, because I remember before Jason got there.
Okay, Jill, I'm gonna let Matt speak real quick because he has to drop off. Matt, do you have anything else you want to say?
I think that it's kind of what Jill just said, like the solutions are there. Like, I don't think this is very hard. I think we just need people to step up and make this happen. And I think one of the reasons that I've been a part of everything that we're all doing is because the people on this call are people of action. And I think that's something that I've personally been inspired by, is, seeing people step up to the plate again and again and again. And it is exhausting. It's hard to keep up with everybody, but it's one of the things that is very inspiring. And I think that that's what we need more of. We need people stepping up to the plate, and the solutions are there.
Thank you. Claudia, do you want to go ahead and do some last minute?
Bye, Matt. Thank you for being here.
Matt, thank
We
you.
love you and appreciate you. So I think my issue is all our Democratic Party associates. Where are y'all? Precinct chairs. Like, I'm looking at precinct 443, precinct 413, 404, 407, 41. 407's pretty good. 401, Anne Marie Love. Who are you and what have you been doing as precinct chair who represents a large portion of the community east of 130? I would really, really love to know if you've been involved. My bad if you have been, but I really, I haven't seen or come across your profile at any of our distribution sites or any of like the community hearings that we have, our monthly meetings. Then we have precinct 101, precinct 105 even. I'm just looking at all of these people who are very integral. Like I said, 407 is doing amazing. Love precinct 407. Great work there. But for the rest of our precinct chairs who are supposed to be, this integral, like key part on the ground, local community leaders, where are y'all? Travis County Democratic Party, where are y'all? I see that one thing that angers me is that, a lot of y'all be so pressed about these propositions, right? Strong mayor and like Prop B, Prop F, whatever, y todo eso, right? But we have Black and brown people dying. Like, you can get loud and angry about that, like liberal, what is it? Liberal Austin Democrats, LAD, Austinites for progressive reform. Like there's other groups like Austin Progressives Moving Forward. I don't know, but there's a lot of y'all that love to be so vocal about things that directly impact you, but when it comes to like the most vulnerable people within your communities, you are silent, and it is infuriating. And I just want to know, where are y'all? You know, this is an open invitation to, like, we're not here to, I mean, we're naming names, but in the sense that this is an open invitation. Like, we need to work together. I mean, whether we like to admit it or not, but we all need to work together. That's the only way that we can really combat this, and you know, put these actions into place. So please reach out to us, listen to us. Don't just come to us for solutions, take it, muddy it up a little bit, and then, you know, throw it out somewhere else. Like, come and help us in our communities. And we have the people, we have the passion and the heart to be able to get this shit done.
Yeah, I'd like to do a shout out to the Del Valley Teachers Association, who have been phenomenal volunteers at all of our events and have donated to the Del Valley Community Coalition, and to all of our donors and our volunteers. Like, we couldn't do this without you. And just note that we are trying. We're trying in the background. We are citizens just like you are, residents, volunteers, and you know, we're doing this because we need to bring more awareness to the neglect and the ongoing just I'm just so fed up right now. But we're still gonna try. We're still gonna work with all these people who say they want to help us, and you know, don't follow through with their words, because we have to. We don't really have a choice. And so we're gonna still push them, still call them, still try to go to their meetings, and still advocate for our community, because we need it. You know, even if we don't want to. I get tired of you know, saying the same, feel like a broken record. And I know that there's a lot of community members, activists like myself, that just get fed up and just like, oh my God, I have to do this again, you know, and then at some point it's like, oh, we have to hear her again. The reason we have to do it is because you hear us, but you're not listening. And you're not following through or saying, if you were, you wouldn't see our faces. Do what we ask you to do, and I promise you we will stop calling you. Yeah, that's all I have. I want to thank the panel for coming on and speaking to our community, and just, you know, discussing all the things that are going on. I know the news is making it sound like everything's hunky-dory and great, but in reality, our community is still suffering, our community is still dying, and we are still being left behind.
Yep.
And so we wanted to bring awareness, and we wanted to just say, like, hey, we're taking names. We're taking names. Don't think that we're here playing around, because this is unacceptable. Yeah, so thank you all for watching us. If you have any questions, please feel free to contact us. I don't know how long this is going to be up, but we're gonna keep pushing. So thank you, Jill, Claudia, Paul, Matt, and I appreciate everybody. Thank you.
All right. Good night, sister.
Bye.
Thank you.